Okay. Good morning, everyone. My name is John Olaechea. I'm the Compliance Assistant Specialist for Region 8 of Osha. And today I'm going to be talking to you a little bit about safety and health in the beverage manufacturing industry, and especially, focusing on breweries. We have a current inspection emphasis program for breweries in Region 8. Well, I should say not necessarily just breweries, but beverage manufacturing, but a large portion of that work is in the brewery industry. So today I'm going to talk to you a little bit about that and a little bit about what we expect out of employers, what employers should be doing to protect their staff and their employees. But first, I want to start by going back kind of into my introduction. I am the Compliance Assistant Specialist for Region 8 of Osha. And as a Compliance Assistant Specialist, what I do is simply outreach. I am not on the enforcement side of things. So you can see on this first slide, I do have my contact information up there. I always say, if you get nothing else out of my presentation, please make sure you get my contact information. I am here. I am available to you for anything that you need with, all questions, all things OSHA. If I don't know the answer, I will, do my best to get you an answer from someone or somewhere. So email probably works the best for getting a hold of me quickly, but the phone works as well. I am doing things like this. Before COVID, I was out in the field doing these kinds of things, and I do prefer to go out there in the field and talk to people, in face to face. But right now we're kind of doing these. But again, my role is just outreach. I do not do enforcement. I was a compliance officer for many years, but I transitioned about 5 years ago into this role. I'm one of the few people that works for federal OSHA in Region 8 that doesn't do enforcement. So again, I encourage you to reach out and ask questions, send emails, and just ask me for anything you need. We're going to be going through a lot of slides today, probably a little bit ambitious for 1 hour. So I may not. We'll spend a lot of time on some, and we'll kind of gloss over a few others. And if you have any questions, feel free to email me. And also, you can submit questions in the chat. Now, I cannot see the chat right now while this presentation's up, but we will be monitoring that, and Matt will be feeding me those, as they come in, or we can wait till the end. It really doesn't matter, but I do encourage you to ask questions. More than anything, that's what I would like to do, is answer your questions. So please keep my contact information going forward. Also, this presentation, I have sent it over to the Brewers Guild, and you can also get a copy of it from me directly by just sending me an email. All right, so, getting started, we're going to talk just a little bit about what OSHA is and where we are and how we operate. And so here's the state of Montana, obviously, and there is one Billings area office for OSHA. It's federal OSHA, and that is the office that holds all of our enforcement staff. Our inspection staff operate out of there. They have, 8 or 10, I think, inspectors. And so if you were to come across one of them on an inspection, they would be coming generally out of that Billings area office. And if I'm not available, they are there to also answer questions. Their phone number is there. They are an enforcement office. Sometimes people don't want to call the OSHA office because they feel like they're going to put themselves on the map, or if they ask a question, we're going to show up. That's not how OSHA works. You can certainly get a hold of them, and they have duty people on the phone ready to answer questions, and they also take complaints. All right, a little bit about an overview of why we have this emphasis program. It's a little bit out of order, but we'll get into exactly what emphasis programs are. But we're going to talk about why we're doing the beverage industry, the inspection process itself. So if you get an inspection, what should you expect? How's that going to go? What's the process? What are your rights as an employer? How can you better prepare yourself or your staff for that inspection? And then some OSHA standards that we typically cite when we do cite the brewery industry and beverage manufacturing, and then a lot of information on compliance assistance resources. There are resources out there and available to you that are free, they're confidential, and they're really set up for small to mid-size employers. So there's a lot of good free information, free resources, free services that will actually come out to your site that are available to you. And then, as I said, questions. I would love to answer any questions that you have. So what does OSHA do? We have kind of three things, the three major things that we do. First is we develop safety and health standards. Now, this takes a long time and is done through our national office. And the folks back in DC, they work on that. And recently we had a new silica standard. Doesn't really probably apply to the beverage manufacturing industry, but those standards take a long time to create and then to put through. And so, sometimes it takes like a decade to do that. But that's what is largely done up at our national office. But then all of our field offices, what they do is they conduct inspections and enforcement activities to enforce those safety and health standards. So that is what probably the majority of the OSHA staff work on. And then we also produce a lot of compliance assistance products. I'll talk a little bit more about that in a bit. We have a great website full of easy to understand information, and then people like myself who are available to you to discuss anything that you may want to discuss. Employer rights and responsibilities. So as an employer, you do have to provide a workplace that's generally free from recognized serious safety and health hazards. You have to provide training and protective equipment to employees. And keep in mind this, for those of you who may use staffing agencies or temp services, you do have to provide those temporary employees that you actually direct. You do have to provide them with the same training, same protections that you would any of your own employees, because you're essentially in charge of them and their supervision while they're on your property. Then you do have the ability to come up with your own safety rules that exceed OSHA standards. So you can implement other things, especially with COVID going on. And we might have a moment to be able to touch on COVID if I have some time at the end. But as an employer, you have the ability to enforce things that are above and beyond, that are even safer than the OSHA requirements, but you at least have to be in compliance with the OSHA requirements. And then anything, say training-wise, personal protective equipment-wise, that is required by the OSHA standard, as an employer, you must enforce those rules. So if hearing protection is required in a certain room where there's a lot of noise, as an employer, you have to ensure that the employees actually use it. You can't, as an employer, say, well, the employees don't want to use it. That is up to the employer to enforce the use of it when it is required by an OSHA standard. All right, so how do we come to inspect facilities? There's two major ways in which we will come out and do an inspection. The highest priority that we have is unprogrammed inspection, and that is an inspection in response to essentially a report from the outside that says, hey, there's a unsafe, unhealthy condition, some type of hazard, serious hazard in this work site. And those include complaints, referrals, and reports of fatalities or accidents. Complaints are a complaint about a hazardous condition from an employee or their representative. So it could be a current employee, it could be their attorney, it could be their mother, father, spouse, it could be a union steward, union representative, someone like that. So that is what we call a complaint. A referral is like a complaint about a hazardous condition, but it is from someone who is not an employee or their representative. So that could be another government agency. The health department comes through and they see something that isn't really covered by them, but they think, hey, that's an unsafe situation. We're going to call OSHA and tell them about it. or it could be a client or a customer or just somebody walking by. We get a lot of those types of referrals in the construction industry because you can see what's going on in a construction site from the street or the sidewalk. And a lot of times people who understand what the rules are, we'll see people working way up high without fall protection or in a deep trench without cave-in protection. And so they'll call OSHA and let us know. Then we also have reports of fatalities or accidents. Employers are required to report any fatalities to OSHA within 24 hours. They must also report any accidents, or I shouldn't say accidents, incidents involving the hospitalization of one or more people, an amputation, or an eye loss. Any of those three things have to be reported to OSHA as well within 24 hours. And I think I misspoke. I said 24 hours on fatalities. It's 8 hours on fatalities and 24 hours on these other incidents. So those are our highest priority. When we get those types of reports, we go out and do those inspections first. When we don't have any of those, we will go back and do what we call programmed inspections. So a programmed inspection is, we call them emphasis programs, and they are focused on certain industries where they may have high rates of injuries or illnesses, or they may have certain particular hazards that we feel, at least industry-wide, are not necessarily being dealt with properly. So here are the National Emphasis Programs. That's what NEP stands for. These are the National Emphasis Programs for fiscal year 20, which actually ended yesterday. So we will have a new list this year. We'll update in the near future, but it will look very much similar. A lot of these have been on the list for quite a. So for example, amputations in manufacturing. Those are facilities where we expect to see machinery and other types of equipment that may cause hazards where, you know, employees could get a finger caught, an arm caught, a piece of clothing caught, and get, you know, have an amputation or a laceration or something like that. So we're looking at facilities where you're going to see presses, grinding equipment, saws, things like that. So in these programs, what you'll find is it'll say, you know, hey, here's why we're doing these inspections, a little bit of background about that, and then here's how you get on the list. And then here's how we're going to construct these lists. And here's a little bit about how the inspection is going to occur, or what the process is, what we're looking for. Is it a comprehensive facility-wide inspection? Is it going to be focused on one area of a facility? And so that's what you have in these emphasis programs. Now, if you get this presentation and PDF it, you can click on these links. There's a link at the bottom, and there's also the picture of the actual emphasis program on the side. You click either of those, it'll take you to the list of all of our emphasis programs, both national, regional, and local, and you can download any of these and take a look at them. So those are our national emphasis programs. Those are what is being conducted across the country. These are our regional and local emphasis. You can see, and you can get these by going to the same website. You can see here that we have a number regionally where in our 6-state region, we are conducting these types of inspections. And then we have some that are local that are just in the jurisdiction of the area office in parentheses. You can see in red there, we have beverage manufacturing. That used to be a local emphasis program in the Inglewood area office for the southern part of Colorado. We expanded it last year to region-wide. So now we are doing that in Montana. Now I will say, you know, because of COVID, we just have not done the kind of inspection work that we had in previous years. So you may not have seen OSHA out in force yet doing those kinds of inspections, but we are targeting facilities that do beverage manufacturing, and one of the industries within beverage manufacturing is breweries. So here you have the NAICS codes. That's the North American Industrial Classification System. Most industries have a 6-digit code associated with them, and you can see fourth down on the list there is 312120 breweries. And so that is one of the NAICS codes on the list, and really, at least here in Colorado, that's where I am. I'm out of the Denver regional. You know, that's been probably the big part of the beverage program that we've been doing. Most of the NAICS codes that we collected were breweries, although we have, wineries, distilleries. The other three, not so much. Why are the beverage makers, why do we have this program? You can see here that when we were creating this program, we noticed a number of things. Injury and illness rates are about double the national average. Musculoskeletal disorders are 3 times the national average. Now, musculoskeletal disorders, or we call them MSDs, those are things like, back pulls and muscular skeletal type of injuries. And so you see a lot of issues in this industry, maybe with some ergonomic type problems. And so they actually are 3 times the national average as far as the MSDs. Now, keep in mind, this is beverage makers. This is not necessarily breweries specifically. This is beverage makers. All those NAICS codes that we saw combined. And then hearing loss cases, 5 times the national average. Another thing that we found was over a 4-year period here in Colorado, we did 22 inspections that resulted in 29 citations. Now, these 22 inspections were largely complaint. Hey, there's an issue out here, and I believe that most of these were breweries because we have, like I said, a lot of the other type of soft drink. So we did find, you know, quite a few complaints, and then we issued a number of citations. And here you can see some of the most common citations that were issued during that period. And we'll skip talking about those because we're going to talk about those in a little bit more detail here in just. I did want to tell you about the inspection process itself. So, if you receive an inspection from Osha, typically, and I'm going to be talking about pre-COVID inspection procedures, they have been altered a little bit now. They're trying to do as much social distancing as possible, and so there are changes to just kind of the nuts and bolts of how we communicate with you and how we do interviews and things like that. But we typically start with an opening conference. So we are going to come out unannounced. We are going to, knock on the door, walk into the office. We're going to walk up to the reception, or if it's a brew pub, we're going to probably go up to the hostess, and ask to speak to the manager or whoever might be in charge of the safety and health of employees. And so we'll hopefully get that top person or one of the top people to come out and meet with us, and we're going to have an opening conference, and we're going to discuss with you exactly why we're there. We're going to talk about that emphasis program, or in the case of a complaint, we're going to say, hey, this is a complaint. We received a complaint. Here are the complaint allegations. We wouldn't share who the complainant was, but we would tell you what the complaint allegations are. We tell you why we're there, what we need to accomplish, how we're going to do that. Is this inspection going to be wall-to-wall comprehensive, or is it going to be focused just on a certain area? We're going to talk to you a little bit more about your employer rights, and we're going to request some documents. We're going to ask you for any kind of written documents that you should maintain. If you have to have a OSHA 300 injury and illness log, we'll probably ask for that. We might ask for your written hazard communication program. If people use respirators, we might ask for your written respirator protection program. So we're going to ask for those kinds of documents. We're going to ask some questions just in general about how the facility works, background on that. But it's also an excellent opportunity for you to ask us questions. If you don't understand what's going on, ask the inspector. I know a lot of people don't feel like they can ask questions of the inspector when they come out because they're a little bit concerned, worried, nervous, whatever it may be. I would recommend that you do ask. Make sure you understand what's going on and have them explain or re-explain things. That would just be my personal advice. And then we're going to go to what we call a walkthrough inspection. And during the walkthrough, we're going to just slowly walk the facility. or portions of the facility that are pertinent to the inspection, and we're just going to look. We're going to be looking for hazards. We're going to be looking, is there anything here that we see that could be hazardous? And then we'll delve deeper into how, as an employer, do you handle that? How do you protect your employees from those hazards? We'll be taking pictures. We'll be taking video. We'll be writing stuff down. None of that stuff is secret, but we can't really give it to you. So I always recommended, when I was an inspector, to the employer or their representative, hey, if you got a video camera, bring that along, or your phone or whatever. You can take the same videos that I'm taking. I'll explain to you why I'm taking it. Sometimes we take videos to show that it's a good thing, especially like on complaints. We have to document non-compliance, but on a complaint, we need to document compliance. If somebody calls us up and says, hey, we're working with a table saw, and it has no guard on it, and then we go out and we see there's a guard, we'll take a video to show, yes, there was indeed a guard. We sometimes do sampling. If it's real noisy, we might come back and do some noise sampling. We might do some sampling on air contaminants that could be in the area based on the conditions at whatever facility we're at. We take measurements. If people are working on a second floor and there's no, it's a balcony or something, or a mezzanine, and it's kind of open to the next floor and there's no railing, we're going to take a measurement to see how high that is. What is their exposure to, how high of a fall? And then we do employee interviews. These are always private and confidential. After we walk the site with the management, we'll pull a few employees aside and just talk to them about their experience there. That is something that we do privately with the employees, and we do not share the information with employers. And it's important to note that employers cannot punish any employees for speaking to OSHA, for participating in the inspection. And that's something that we cover in that opening conference. The opening conference is pretty detailed. Then we'll have what's called a closing conference. We will, it may be that day, it may be another day, because it may be that we have to come back and do additional work in terms of some sampling. On occasion, we may even have, there are facilities where we'll come back out and do like an ergonomic assessment, especially if we're looking at your injury logs and find that, I've been to facilities where you have 5, 6, 7 people in a year with the same exact injury doing the same task. And it's like, well, we need to take a look and see how this task can be done better. If everybody's pulling their back doing this, then we need to really analyze that and see how it can be done better. So, but we will eventually come back and do what's called a closing conference. And in the closing conference, we're going to talk about the inspection and the results. If it was a complaint, was the complaint valid or not valid? Why not? If it was a, emphasis program type inspection and maybe a comprehensive, we're going to talk about, all the things that we observed, violations. We'll talk about some good things too. But what the employer needs to do to come back into and achieve compliance. And that really shouldn't be a secret. I mean, we should be telling you that along the way. We'll walk through and say, oh, okay, this may be an issue here. But we will kind of summarize that again at the end of the inspection. And then we'll discuss with you your employer rights and responsibilities. If there are going to be citations, and they have penalties associated with them, we will be sending you out a packet later after that closing conference, but we will discuss with you, your options. There are a couple ways to appeal those citations. It's just like a traffic ticket. You do not have to just pay it. You have the right to appeal it. There's one thing called an informal conference, where you can just come into that local area office. In your case, it would be the Billings area office, and you sit down with the supervision and you try to work something out. What we're really looking for, and most things are settled that way. Like probably 99% of all citations are settled in that informal conference. What they're really looking for is assurance from the employer that that's not going to be a continuing problem. And if you can show us that, and it's the first time, I think they're very reasonable in kind of working with you and making some modifications to those original citations. But there's also something called the contest, which is essentially both sides go to court. They appear before a judge, present their arguments. You would probably want to get an attorney involved at that point, but that is also an option. It's also an option even after you do the informal conference. If you feel like you didn't get what you wanted out of the informal conference, you can go ahead and do the contest. So there are a lot of options for the employer to appeal anything that they disagree with. And then also during that closing conference, we're going to discuss, what kind of citations are coming. Are they repeat citations or willful? Those are kind of high-level citations that we don't give out a lot of, but we do in some cases where employers, with repeat, have gotten a citation like that before and just haven't fixed. Well, they might have fixed it, but they let it backslide again. Willful is just a willful disregard of the standards and the hazards. The employer knows that there's a hazard there, a serious hazard. They refuse to do something about it because of money or time or something like that. We generally don't give those out. They are kind of more egregious type cases. Most of our citations are either going to be serious or other than serious. Matt, can you still hear me?
I had to unmute myself. I sure can.
Okay.
Your slide presentation went away from.
Okay. Is it back up? Okay. I don't know what happened there.
Back in slideshow mode. Yeah, that's where you want
it. Okay. All right. Yeah, I don't know what happened. I didn't touch anything. It just kind of everything appeared on me. All right. Okay. And Matt, also, would you mind giving me like a 5-minute left kind of warning?
Yeah, sure thing. We have about a half hour, so you're doing
okay.
Good. I'll give you a heads up. You wanna leave 5 minutes at the end for Q&A? Is that what you're saying?
Well, actually, give me a 10-minute, and then I'll end with 5 minutes left for Q&A.
Perfect.
Sorry about that, everybody. I don't know what happened to my presentation. Okay, so here's some tips for a successful OSHA inspection that I would recommend to you. Number one, know the hazards in your industry. I'm going to help you out with that here with the rest of the presentation, so we'll leave that for a second. Know your injury history and trends. If you are keeping OSHA 300 logs, injury and illness logs, or if you are you should be tracking any kind of worker comp claims. If you're big enough, you might actually, if you have enough employees, you might see some trends develop and analyze that and determine, hey, if the same kind of injuries or illnesses are occurring, how can we, look at that and kind of try to figure out a better way? Why are these happening? What can we do about it? Conducting audits and hazard assessments. I'm also going to talk about that here in just a second. But written programs and training records, anything that you have or are required to have under the OSHA standards, those should be available and ready to be, handed over to OSHA. And make sure that if you're the owner or the general manager and you're going to be on vacation, that people know where those things are. I mean, really all your staff should know where those programs are because they should have access to them and should be familiar with them. And that goes along with preparing your staff to participate. If you're the owner or the GM and you're going to be out of town for 2 weeks, make sure that, especially with this emphasis program going on and us coming out and conducting inspections of breweries, make sure that, you're leaving someone behind that knows what they are supposed to do. What are their instructions from you as far as how they're going to handle the OSHA inspection? A lot of times, we'll go into a facility and the person we're working with is rather nervous, which is totally understandable, but they're just as nervous about, disappointing the owner as they are having OSHA out there. And so, what is it that you want them to do? Do you want them to, contact the attorney if you have one, or what are their instructions? So give them a little bit of information on exactly how they're supposed to handle it, and let them know that OSHA may be coming out there. Then here is a link to just general employer requirements. There's about 20 things listed if you go to this website. And if any of those things do not make sense to you, or you are not currently doing them, feel free to reach out to me and we can discuss them. I can send you plenty of extra information on how to comply with those things. You know, in some cases, it may be a written program or a poster or whatever. Please take a look at that. And if those things don't make sense to you, we're not going to go through them now. Let me know and I will send you information, or we can discuss it and work through it. All right, frequently cited OSHA standards. This is a really useful tool on our website, and the link is down at the bottom. But if you go here and put in any NAICS code for any industry, you will generate a list of all the citations that OSHA here. So if you put in, for instance, 312120 for breweries, you're going to see this is what OSHA cited October 2018 through September 2019. So this is 1 year previous to now. And so you can see this is a list of those citations. Now the list continues. I cut it off just so I could put it on here, but it does go further than what we got here. But you can see that the #1 citation is hazard communication. And we'll talk a little bit about that in just a moment, but that is essentially how the employer effectively disseminates information to their employees about the hazardous chemicals that they have to use on the job. Respiratory protection was next. Electrical, using, making sure that your equipment is rated for the environment, not having non-wet or water rated electrical in a wet environment, or overloading things, or even having stuff that's damaged. So there's a number of things here we'll get into. One of the things that's missing off this list that was #2 the prior year is confined spaces. And so we are going to touch on those here in just a sec as well. But you can generate this list, and then you can see that the standards themselves are hypertexted. So you can click on those to see what the read more about the standard and get more information. And then our website has tons of just plain language guidance documents on pretty much all of these things. But this is a good tool to kind of run this report and then make sure that, hey, are we in compliance with all these standards? Because when OSHA does an inspection on a brewery, this is what they find. So it would be a good thing for you to do. Good exercise. So in addition to those standards that you saw there, here's just, some of the standards that we kind of anticipated being an issue possibly in beverage manufacturing. And, if you're using powered industrial trucks, which are forklifts, you're going to need to make sure that people get certified to use those, that they get retrained, that they operate them properly, that they're maintained. We have that whole standard on powered industrial trucks or forklifts. Control of hazardous energy, that's a big one. If you are going to have your staff maintaining equipment, if they're going to shut something down and get in there, and they could potentially, get either shocked or get finger caught or worse, if the machinery were to suddenly start up or energize again, that is a major problem. And so that's something that we look at in most facilities. And so you've got to have a way of controlling that energy so you don't have that unexpected startup of the equipment while someone's working on it. And so that's typically, you'll hear lockout, tag out. That's what we're talking about, locking out the power so that it's off and it can't be re-energized only after the person working on it actually uses their key to unlock the lock, so nobody else can just come along and hit a button and turn it on. Ergonomics, we kind of talked about, there are situations where employees are working in ergonomically kind of hazardous condition where they're bent over, or they're doing a lot of fine manipulation with their hands, or they're in awkward positions, or they have to use too much force to do the work that they're doing. And so those can lead to musculoskeletal disorders. Now, we don't really have a standard on that. We just have what we call our general duty clause, which is section 5A1 of the Osha Act. And that says essentially, employers have to provide a workplace free of recognized safety and health hazards. So if you have a trend, a major trend, where, as I said before, people are getting the same type of injuries doing the same thing, that is something that you should, as an employer, investigate and determine, is there a feasible way to make this more ergonomically correct. Process safety management probably doesn't affect almost anybody on this call, but if you have a refrigeration system that has more than 10,000 pounds of ammonia in it, I would say just give me a call, unless you're already up to speed on process safety management. It's a very complicated hazard. I won't go into it any further because it probably doesn't affect most of the small breweries. But if you have a refrigeration system with 10,000 or more pounds of ammonia in it, then give me a call. We'll talk about it, unless you're already on top of process safety management. Hazardous noise, there could be, if you've got employees that are working in an environment where they are exposed to noise at 90 decibels as an 8-hour time-weighted average throughout the day. So their average noise exposure is 90 decibels, 90 decibels is the limit that they can't be exposed above that. But if they're above 85 decibels, then as an employer, you do actually have to take some actions and even create what's called a hearing conservation program. Usually, if you have to yell to talk to people, that is a definite sign that you need to look into that. Confined spaces, we're going to talk about in a second. Hazardous chemical exposure, there may be situations where you have an environment that may have some chemical exposure, carbon dioxide, or whatever it may be. You can monitor that, but you have to make sure that employees are not exposed above certain what we call permissible exposure limits. And we have 1910-1000 that has a whole listing of various chemicals and what the limit of exposure can be. And then if some of you have grain handling facilities associated with your operation, there's a whole standard on that, but I won't really go into. Confined spaces. I do want to take a moment to mention that. So a confined space, so we have a confined space standard or a permit required confined space standard. And so as an employer, you have a duty to figure out, do we have any what we call permit required confined spaces? In order to know if you have a permit required confined space, you first have to know, do I have a confined space? Confined space is something defined as three things. It's large enough for an employee to enter. It's limited, or it's got limited means of entry or exit. That means you need to crawl through the exit, or it's not a door that you walk through. It's tiny, or you have to get on your back and wiggle through, or it's a hole, or something like that. So it's not just an easy walk through type door that fits a normal human. And then lastly, it's not designed for continuous worker occupancy. So this would be something where there's typically not ventilation or lighting, normally holds things that wouldn't allow you to, if it were full, it wouldn't allow you to be in there. It's full of water or chemicals or grain or something like that. So if you meet all three of those things, you have a confined space. So a permit required is a confined space per the other definition with a hazardous condition inside, which would be one of these four things. Potentially hazardous atmosphere or a hazardous atmosphere, but potentially hazardous atmosphere. So you've got some vessel and it can contain a bunch of carbon dioxide or something like that. It may not have that in there at the moment, but it could at times. And so that would be a potentially hazardous atmosphere or a hazardous atmosphere, or an engulfment hazard. It could suddenly be filled with water or grain or something like that. Some other type of physical hazard, electrical, or some saw blades or whatever, grinding equipment, stirring mechanisms, or Any other serious safety or health hazard, and when we say serious safety or health hazard, that'd be something that would cause either serious injury or illness or death, or prevent that employee from being able to self-rescue to the point that they would be incapacitated enough to not be able to get out of the space. So if you have a confined space and you have one of these type of hazards in there, now you have a permit required confined space. So these are some examples of permit required confined spaces. Go through them. And then as an employer, you have to, as I said, conduct an evaluation of the site to determine if there are any of these permit required. If there are, you have a choice to make. Will your employees go into these permit required confined spaces? If they will not, then all you have to do is take effective action, like signage. And there's specific language on the signage in the standard where you inform employees and post signs that effectively prevent them from going into those permit spaces. We have seen facilities where there's a sign on it that says permit required confined space, do not enter, but it's general practice for the employees to still enter it and ignore the sign. So it's got to be effective action. If you decide, yes, we will be going in, then you have to implement a full permit program or use alternative procedures, which are also, quite involved. So there's a lot that goes into that. And here's some of the things we won't really get into because it's a very complicated standard. And as I said at the beginning, if anyone needs information, I'm happy to do that. I can even, if you want to, do a Zoom call into your conference room, we can talk about confined spaces for 2 hours. We can talk about whatever you want. I'd be happy to do that with you. So written permit space program, what you have to do is prevent unauthorized entry. You have a permit for entry. So, and that permit kind of talks about the conditions for safe permit entry. How are you going to do that? What are the conditions? People sign off on it. You have to train your employees. You have an entrant, an attendant, supervisor. You have to make sure rescue is in place. So there's a lot that goes into it. We can't really talk about it now, but just keep in mind, if you've got confined spaces, or I should say permit required confined spaces on your site, as an employer, you are going to have to do something about it. Hazard communication. This is the standard that talks about if you're using hazardous chemicals, how do you disseminate that information to your employees? You have to explain to them, hey, these are the hazardous chemicals we're using. These are the hazards associated with them, whether they be health hazards or, fire hazard, safety hazard, those kinds of things. Is it going to permeate through your skin? Is it something that you have to worry about breathing in? Those kinds of things. You have to maintain what are called safety data sheets. They used to be called material safety data sheets. So all these chemicals that are sold, they should have, the manufacturer develops a safety data sheet that has all kinds of physical properties on them, chemical properties, and information about what to do in case there's an exposure, and also exposure limit information. There's a whole bunch of stuff on these, and you have to have those. They have to be current. You have to maintain them. The employees have to know where they are, how to use them. You also have to label all your chemicals. And if you click on those links there, it'll take you to some information on our website that shows you the kinds of labels that you have to use, gives you a little bit of a lesson on safety data sheets and stuff like that. And then you have to provide training to your employees, make sure that they effectively understand, how to protect themselves from the hazardous chemicals that are in use at your facility. Here is an example, like if you click on this labeling link, you'll see a number of things, and this is one of them. This is a sample label. And the HAZCOM standard was actually updated about 8 years ago, and so it's not really more complex now, but it's been updated, and there's kind of more that you need on labels, and there's very specific ways that the safety data sheets. All right. Some of you may have to record your injuries and illnesses. That may be something that you have to do. And so we did not change who has to record injuries and illnesses on the OSHA 300 log, but a few years back, we did change something in the standard, which now requires that if you already are recording, if you have an establishment, that means like one location with 20 or more employees, you most likely are going to have to submit those logs electronically to OSHA. You can do that by clicking on this red tab. Excuse me. Clicking on this red tab and going to our injury tracking application. So most employers have to, if they have more than 10 employees in their company, and that's the whole company, they have to maintain an OSHA 300 log, unless they are in a kind of an exempted list, which you can look up on our website. Now, that list has NAICS codes on there. And I believe that one of the exempted NAICS codes is restaurants. And right now, I don't think that breweries have breweries have a NAICS code, restaurants have a NAICS code, but there isn't a NAICS code for brew pubs. So you've got to determine, are you a restaurant or are you a brewery? And that really depends on what your primary business is. Is most of your income, most of your staff involved in the restaurant side of it? And you've got a little brewery that just kind of feeds the beer for the restaurant? Or is it mostly brewery and you're shipping out to grocery stores and liquor stores, and then you kind of have an associated restaurant? So that's one thing that kind of, you have to figure out to determine if you even have to maintain the records. But then if you have to maintain the records and you have 20 or more employees at any site, that site is going to have to submit those records to OSHA. All right, I'm going to skip this slide because we've already kind of talked about this and low on time here. I want to talk to you about compliance assistance resources. There's a lot of resources available to you. I would start with our website, osha.gov. There's an A to Z index up at the top. Excellent resource. All of the things that we talked about and more are on there. You can click on confined space. It's going to give you all kinds of information, not just the regulations. It's going to talk to you about, hey, here's a small entity compliance guideline that walks you through what you need to do as an employer, how to do that permit required confined space assessment, how to set up a program, those kinds of things. There's e-tools on there, all kinds of publications. There's just so much. It's almost overwhelming, but it is an excellent site. It's an excellent resource. Then we have compliance assistance specialists like myself. Once again, I will offer it to you. If you want to call me, call me. If you want to email me, email me. If you want to do Q&A or some type of presentation in your conference room, be happy to do that as well. We can do it remotely now, or in the future, we can look at coming out, once kind of COVID's over. OSHA consultation, we're going to talk about that in a second. And then NIOSH, also, that's the National Institute of Occupational Safety and Health. That's kind of a sister agency to OSHA, and they are the research and kind of development section where they really just, they're not enforcement. They put out all this information about how to deal with safety and health issues, and they can even come out and by request do some assessments of your facility if you have a particular kind of issue you'd like to have them look. All right, compliance assistance resources, like I said, there are many of them. This is just like a snapshot of one of our websites. More stuff with e-tools, advisors, help for employers. This is a good website. If you go to our website and then go to About OSHA or just this link here, there's all kinds of FAQs and just, as an employer, what are my general responsibilities? Hazard ID safety tool. It's kind of a game you can play to figure out, what are the hazards on our site. And now I'm going to talk about consultation. So each OSHA Well, each state has what's called an OSHA on-site consultation program. So I am technically on the enforcement side of things, but every state has an OSHA consultation program that is federally funded, but they are state employees. And for instance, here in Colorado, we have one run out of CSU, Colorado State University, and it has about 8 people who get the same type of training as OSHA inspection staff. They actually get it in the same place, but they are separate from enforcement. They do not, we don't really talk to each other in terms of enforcement and consultation, and they offer free services that are essentially consultant services to small to mid-range employers. And so they can come out to your facility. They can do all kinds of things. They can do a site walk and write up in a report that's going to look like a kind of like a OSHA citation report, but it's going to say, hey, you got this issue, this issue, this issue. This is how you should fix it. There's no fines. And it's completely confidential. They do not tell the enforcement side where they've been, who they've dealt with, or anything like that. So it's a really, really good resource. And I've met, and now that I'm in this role, I do talk to a lot of them, and they're really good staff, and they're really useful. They really go to bat for their employers. They really try. They're very protective of the employers that they work with, and so you can contact them and get them to come out to your facility, or just work with them in other ways. You can have it be a full comprehensive visit, or kind of a more of a focused thing where they're just looking at a certain aspect of the business, or they're doing some training for you, or maybe they're doing some sampling. Maybe you want some noise sampling done and you don't want to hire a consultant, you don't have the equipment. They can come out and do that kind of thing. So, but they'll talk about that with you if you contact them. In Montana, this is the consultation program. And so they're real. I mean, I know a few of them, and they seem to be real good, real professional staff. I've heard nothing but good things about them. You can contact them by going to that website, or by calling them and setting up any of these free services. Once again, it's free and confidential. Now, there is one caveat. If, as an employer, they find some real serious hazards and you don't fix them, at some point they do have to turn that over to enforcement, but because they can't know about that and just let it go forever. But they work with employers. They give you plenty of time and opportunity. And I've been with OSHA like 13 years. I've only heard of one person ever, or one employer ever being turned over to enforcement. So it is a very rare thing, and they do not want to do it. That's the last thing that they want to do. But they can explain all of that to you if you give them a call. Here's just a little bit more about them. And then lastly, I just want to finish with just a brief, I've got a few slides on here. I cannot go through them all. A little bit about COVID. It has affected all of us, the economy, the service industry. For those of you who have brew pubs, I'm sure you've felt this intensely. OSHA, just a little bit about our role in all this. We typically, during these kinds of emergencies, whether it be 9/11 or Katrina or whatever, we want to take a technical assistance posture. That's what we're trying to do. We've put lots of guidance documents online, and there's a lot of good information. It's almost overwhelming. But as far as what we expect of employers, there are no actual OSHA standards on COVID. There are no standards on pandemics. But there are other standards out there. And just keep in mind, during this period, we do still have enforcement authority and responsibilities. We are receiving complaints. We're actually getting lots of complaints about COVID exposure and things like that. So we do have to deal with those. But what we really want to do during this time is just provide assistance to employers on what they can do to protect their CDC on that. And so we've tried to put out as much information as we can. Now, as I said, there's no COVID standard from OSHA, but there are a few existing standards out there that we use. The first one being, some of these PPE standards that you see in the blue box here or the green box. And 1910-132 actually requires that all employers conduct what's called a hazard assessment to determine what are the hazards faced by our employees based on the tasks that they're doing. So generally, like in the past, you would have looked at, say, this guy's using a grinder. Well, he's grinding, so he could have chips and things flying off. So he needs to use eye protection. So you determine what's the task, what's the hazard, and what is the way we're going to protect them. So you have to do that. And as an employer, you should be looking at that in terms of COVID. What is our risk? Do we have high risk? Are we in healthcare? We're doing some sort of procedure where, we're going to be around COVID infected people or suspected COVID infections? Or do we have kind of more of a medium risk where we're going to be around a lot of people, whether that's other coworkers or the general public, and we're going to have sustained contact, but they may not necessarily have COVID? Or do we have low risk? We have a couple of people working where they can easily social distance, and they're not using the same tools and parts and stuff like that. So as an employer, we do expect you to kind of look at that, figure out what you need to do to protect those employees. I'm going to skip through some of these enforcement discretion guidance documents because we don't really have time, and just show you that we do have a page full of guidance documents. There's a really good one called Guidance on Returning to Work that is towards the top of the highlights, if you can see that, in the column to the right. The first bullet point under highlights is guidance on returning to work. You can download that document. It tells you as an employer, hey, this is what you should probably be looking at to protect your employees. We also have a one-page alert for the manufacturing industry. There's just some pretty simple things, a list of 8 or 10 items that we expect employers to look at to try to employ those methods at least to protect their employees. So if we were to get a complaint about COVID exposure at your facility, one of the things we do if you're in the manufacturing section is probably look at that document and see, hey, as an employer, are you doing these things? And if not, why? If these are feasible things that you can do, you should be doing them. And again, we don't have a regulation on COVID, but we will fall back to what we call the general duty clause to enforce those things. It's a little bit tougher, and it's a difficult time for everyone. Employers were hit with this and don't really know what to do, and or didn't at first, and OSHA's trying to work through this as well. Here's, as I said, the return to work guidance document. It lists all these things that you need to do as an employer. And then lastly, I would just say, I'm going to pause for questions. Compliance Assistance Resource newsletter that we have, it's a regional one. If you would like to be on the list, please send me an email and I will put you on the list. It was coming out about weekly when COVID first started for a few months there, but it normally comes out more quarterly to every. I think that is all I have. Does anybody have any questions? Matt, I don't know if there's some you want to feed me from the chat box.
I have not seen anything come through in the chat box, so just
okay.
Reminder to folks to, if you don't want to type your question in, if you want to say it verbally, just type in the chat box, I have a question, and we can bring you live, and you can ask your question verbally. I love the safety first picture. Make sure you put your keg in the seat belt if you're driving down the road.
Yep.
Don't need your keg going through the windshield, right?
All right. I will I think I'll just out of the stuff.
I mean, even if we don't have questions from the audience, if anybody in the audience has experience working with Department of Labor with their consultation program, feel free to share your experiences there. All right.
All right. Well, I'd like to say one more time that feel free to contact me. I'm available for virtually anything that you need. So just let me know.
Well, thanks so much, John, for joining us this morning. We were hoping to
Yep.
have you here in Montana for our conference, maybe next year, right?
Yeah. Yeah. We can definitely look at that.
Well, and thanks everybody for joining this morning. Reminder that in a half hour we have our virtual trade show. So please catch us there. We sent out the link for that. We're actually going to do that through Zoom today. It'll work better to have people talking face to face through Zoom rather than using Crowdcast for that. So hope to catch you at the virtual trade show at 11:30. All right. Thanks, everybody. Thanks, John.
All right. Bye-bye.